And this is not my science. This is what I've learned, what I've been reading about, what I've researched, what patients have brought to me over the years. And I've been like, oh, well, that's pretty interesting. And then I've expressed my own personal habit of cannabis use for health and as a supplement in my life.
Let's ditch the quick fix and dive into today's conversation. I'd love to kind of switch gears here a little bit, because as I was prepping for this interview, I came across the new book that you put out that released in January, Foundations of Health. And I wanted to kind of dig into that a little bit. And, you know, I know we might
this book is my pride and joy. I'm so proud of it.
I'm excited, and I want to get it and read it. I haven't got that chance to get it yet, but as I studied for this, that's going to be my next read. I'm going to pick that book up. It really gets into some areas of health that I think are really important, because some of the pain management that we've tried to do over the years for back pain, for joint pain, for you just go down the list. As you know, I'm telling you things that you know, but for our listeners, you know, we've tried everything, the pharmaceuticals, you know, surgery, you know, all those different things. And we've tried with a lot of success, a lot of natural things as well. Mm-hmm. But it turns out we've been missing some very positive help from the plant-based medicine. And this is a little bit controversial because it's so new. It's just now being legalized in states. You know, we're talking about, you know, the cannabis plant and how the uses are being used now, oils and edibles, and, you know, the historical smoking and inhaling, you know, those kind of things. I know that's part of your book. It's not the whole part. It's not the whole book.
It's one of three parts.
I would love to touch on that one. And if we had more time, I'd love to touch on the others, because you really look at the whole body health kind of strategy, nutrition, stress management. I'd love to talk to you about cold baths, ice baths, sauna, all that kind of thing. But if we could focus in on this part of your book, I'd love to do that for a few minutes.
Please. Yeah. Ask away. I'm happy to discuss.
So we're cannabinoids is what we're really kind of going to talk about. And I'd love for you to kind of just give a foundation on that, you know, for what we're going to talk about. The body's natural internal system of that endogenous reality that we've had. And I think your book probably lays this out real well. So if you could touch on that system within our body that's already there, it's all already part of our own body's ability to heal itself. And then maybe touch in onto the environmental, the exogenous parts that people have used for years, and how we might be able to maximize that and go from there.
So the first thing I will say is I wrote this book for people in pain. And I use this to speak with you as though you are my patient. And I'm giving you as much information as I can from my experience with patients over 15 years or 14 years now, and myself. And here are the three biggest things I've learned for pain management. And one of them, and this is not my science, this is what I've learned, what I've been reading about, what I've researched, what patients have brought to me over the years. And I've been like, oh, well, that's pretty interesting. And then I've expressed my own personal habit of cannabis use for health and as a supplement in my life for many things. So I'll go into those two things.
Perfect.
The first is the endogenous cannabinoid system, the ECS. That's in every mammal, every vertebrate in the world. It is older than human beings. It is the homeostasis adaptive center of the human body, the vertebrate body, the mammal body. Again, it is not unique to human beings. It's called the endogenous cannabinoid center or system because they found it while they were studying the effects of cannabis on the body. And they kept seeing this body-wide, every tissue in the body, almost like fascia. Really interesting correlations between the two, in fact. And it was, pardon my words, but everywhere. It was everywhere. It was like toes, head, hair, heart, lungs, digestive system, jaw, everywhere had these cannabinoid receptors for CB1, which is more central nervous system, and CB2, which is more immune system cells. And if you have enough arachidonic acid, omega-6 fatty acid, linoleic acid is another one that will work, your body, and enough glycerol, so sugar, your body will naturally break those things down into two endogenous cannabinoids that exist within us. Anandamide, the pleasure molecule, you don't have to smoke it. It's there. It's in already. You have to stimulate it with exercise, with sauna, with ice, with healthy foods, with cannabis. The stimulations stimulate and activate this homeostatic-like system that helps us determine what neurotransmitters to secrete in the face of stress, helps us determine the ecosystem and barometric pressure around the digestive tract, around the cerebrospinal fluid, around the lungs, around the heart. It helps the vagus nerve better communicate the digestive ecosystem to the brain and vice versa. It helps the vagus nerve also better stimulate the production of serotonin and dopamine in the gut. Each of these things, and if you look at my second book in 2016, I'm very deep on the vagus nerve, and you can see this climbing of the ladder of information of nerve health and overall well-being. So between 2015, 16, and now, I've really deeply explored chronic pain, chronic autoimmune disorders, and the people that use cannabis. And they get better. If they don't get better, they don't get worse. That's the other difference, which is a very, very big difference. In Alzheimer's, in Parkinson's, in multiple sclerosis, in Lou Gehrig's, in ALS, you don't stop the process, but God, do you improve the quality of life, the inner language and dialogue of the patient, the chances of the patient enjoying their time, having more of it, and having the ability to stay communicative, to stay able to enjoy the social aspects of life with other people. That's what cannabis does for a lot of people. That's what anandamide does. Again, if you're not, I completely understand and respect a stigma and a lack of desire to entertain the idea of cannabis, herb, pot, marijuana, whatever you want to say. For those people, I highly recommend at minimum a compound spectrum CBD oil, which has no THC. It's fully legal, and it will stimulate your body's own production of, boom, anandamide and 2-AG. That's what CBD does. CBD is not an endogenous cannabinoid itself. It is a stimulator of the endogenous cannabinoid system, and the more you have it, the more it stimulates. The health impact of this is like meditation. It's like going for a 3-mile walk every day instead of sitting on the couch. It's like exercising at high intensity and having enough nutrients and nourishment to improve and feel well from it. It's a benefactor to the body. It's an opportunity to adapt in healthy directions or unhealthy directions, especially when you start to smoke or ingest or eat edibles or smoke pot on a regular basis. You literally have the opportunity of adapting actively or adapting passively. You know, conventional stoner over here, TV, potato chips, cookies, not that stoked, not that happy, life's not going that well, you kind of can't figure it out. I've been doing this a long time. I've written a lot of books. I've helped a lot of people, and I'm finally comfortable telling people how much of a part of my life it's been. And I became comfortable because so many people I look up to are the same. And so many patients that I fell in love with over the years, they use it. They don't drink. No, drinking's terrible for you. They don't take opiates. Come on. I don't want to dissociate from the rest of my life. They don't take muscle relaxers. I like to feel myself. I like to feel strong. They take cannabis and cannabinoids and electrolytes and fish oils and different things like that,
Yes, that's really a good distinction, that stigma there. I think what, just to kind of paraphrase a little bit of what you're saying is that, for anything to work well, and you kind of shared this before we started recording, you got to be active. You can't be passive. Now there's time for rest. We need to turn that parasympathetic system on often and try to get out of that fight and flight kind of reality. And, the vagus nerve health that you're talking about. So how do we really, basically address things well, whether it's, whatever it is, how do we use it to our advantage without the injurious part of it? And so that is one of the stigmas that I mentioned I'd probably ask is that, there's not only the tendency to think that you can't be a functioning person in society and use this particular product. Yet we've found with cancer patients, it's been one of the best things that they can use. We've found in comparison to the pharmaceuticals that are out there that really are so injurious, they're not side effects, they're harmful effects, kind of thing.
Exactly.
So the smoking part, and I brought this question up to you, and I wanted you to share with our listeners that, that would be the one thing when I'm talking to my patients now, I'm trying to find good CBD products to recommend to my patients. I'm excited to hear that patients are using them, and I think that people should consider that based on, working with a professional. But the smoking one I have had a little bit of a concern for carcinogenic kind of concerns. And I think that you've been kind of looking into that. And what have you found so far?
So I mentioned there's a number of studies, but the most interesting one is a UCLA study that was done a handful of years ago, where they took a pretty substantial amount of chronic pot smokers. And they were trying to prove exactly what you just said, which was, no matter what it is that you smoke, it's bad for you, because smoking is bad for you, which I agree with, quite frankly, even though I smoke. I don't smoke cigarettes. I don't smoke cigars. I smoke a little pot. And when I smoke a little pot, I use a hemp wick that burns at a lower temperature than a butane lighter or a match. And I only smoke flower, nothing else, no tobacco, no papers, nothing. Just a little pipe and a little plant and a little heat. When you do it that way, based on these studies, there appears to be a protective pulmonary impact where your lungs not only, it's very interesting. And mind you, this is zero tobacco, zero anything other than cannabis and hemp. But you can go look at the study, UCLA, go look up UCLA pot smoking study, just type that in. And you're going to see a handful of doctors that had their minds changed on the efficacy and well-being capacity of smoking a joint a day for many, many, many years. And there's other studies that have started coming out that show a very similar thing that show that, if we want to get really into it, look at the Israeli studies on cannabis and COVID, where the smoke was competing against the COVID virus to get into the alveoli and winning. People weren't getting affected and infected in it. And there's Forbes articles about it. Just read it. Just go read. It's so interesting. It's not a cure in any way. And that's the thing with cannabis. It's not a cure for anything. It's a competitor. Cannabis competes with other substances in the body, including things like caffeine. It's a competitor because its web is so vast. It kind of interacts with everything in the body, every cell type in the body. As you're smoking it, if you're only smoking it with nothing else and you're not smoking all day, every day, but you're having a couple tokes here and there, you seem to be doing something that is beneficial to you. And I only say that based on literature that I've read that is making my skeptical brain say, really? And I have some patients and some very close friends that are in their 70s and 80s that have been smoking pot since they were teenagers. And their cognition is extraordinary.
That's
for a 70 or 80-year-old.
That's really interesting.
Neural protective. Pot works with the endocrine system, not really any others. It works with the immune system as a stimulator, but it really works to impact and guide, like dispatch for the endocrine system. Mm-hmm. And endocrine-based tumors tend to respond very, very well to cannabis, whereas lung cancers and different things like that don't. But pancreatic cancers and different things, they really seem to. Brain cancers tend to as well. There's a neuroprotective element to cannabis that it's significant. I'm very willing to say it's significant based on everything I've read. And that's part of this new book is like, you guys are coming to me for advice. Well, here's what I perceive to be the truth. And I'm willing to kind of stake my reputation on it. Here's what I really think is the truth.
Yeah, and the studies will continue to be, I think, the way the trend is going, it's just going to be natural that the studies are going to continue to come out, just like chiropractic, for years.
And I might get proven wrong. If I'm proven wrong, hey, so be it. I hope I'm not, but.
Yeah. Well, and it's one of those things that the studies will continue to come out. And right now, all of the initial studies look great. All the anecdotal information looks great. And in comparing to what the mess is with pharmaceuticals, I apologize, I'll probably get taken off for saying that. But, it's just, I think it's a great thing to try. Another thing that, that I checked out just briefly, to just kind of ask the question, and it was brought to my attention that there could be a connection with using marijuana, cannabis, and emotional well-being, specifically schizophrenia. And I think you've looked into that as well. And it would be interesting to see where you're at on that and what you've found.
Yeah, I think anybody that has a tendency or a familial history of legitimate schizophrenia should probably avoid pot. They can take CBD. CBD does not have that correlation. That is a THC specific correlation. But yeah, it's real. And if you have people in your family that have multiple personalities and that's legit, you could have a tendency to lean that direction. And cannabis, and that being said, I'd love to see the studies on alcohol. I'd love to see the studies on different things like that, on what they can do.
We also see improvements in a lower scale emotional fluctuation type patient, where you see them using pot as a great low grade self-medication to keep them somewhat level, somewhat relaxed. Now, again, there's a huge cliff you jump off with major mental health issues. I'm not talking about that cliff. Right. There is a pharmaceutical industry for that. There is a very specific mental health industry for that. I will simply say that between foundation training with decompression breathing, sauna use, which I'm very recommend in that book, I recommend it really highly, but traditional sauna use, dry sauna use, not infrared. Not that that's bad. I just really believe in traditional. When you combine cannabis use, and it can only be CBD, that's fine, sauna use and decompression breathing, the mental well-being impact is significant. And if you keep it as a disciplined daily practice, I do not believe for a second you are going to fall off of any mental health cliffs for that disciplined approach to balancing your mental health.
Gotcha. Yeah, I was still there. So, and what I was going to say, I think this is just such an important conversation to have. As we've just opened the floodgates of cannabis, let's have these conversations.
Yeah.
Let's get them out. And I appreciate you being willing to stake your reputation, because you have a great reputation. I don't think it's going to be tarnished by this at all, because you're communicating in a very, I think, responsible manner and respectful manner as well.
Thank you.
And we want to help people. We want people to have all options out there and to understand them.
Man, if somebody can go hand somebody Percocet, Oxycontin, and fentanyl, and morphine, and these things that have proven track records of genocide, I mean, not malicious.
Right.
But let's just crack the window for a second. Oh, that's a lot of dead bodies. Close that up real quick. This is such a viable alternative.
It is.
It is such a powerful alternative for the 80 to 90% of patients that don't need extreme pharmaceutical medicine. But there's going to be 10, 20% that do.
Yes.
But for the other ones, exercise, purging. Sauna is a purge. Sauna is like a hydrostatic pump that pushes lymph out, pushes excretory sweat out, and allows you to really heavily rehydrate yourself. So very often in well-being, it's not what you take in, but what you get out. And I think that the sauna expresses that extremely well.
Yeah, I really enjoy sauna. I don't know if you've looked into, I know I like the ancient sauna strategy of high heat. I've been utilizing some of the infrared myself, and specifically recently a little bit more of the near infrared that Brian Richards, if you're familiar with sauna space.
How do you like it?
I'm really liking it. And
Nice.
I bought a photon light therapy for each of my children, 4 of them, for Christmas, and they're loving it. And some really good testimonials already. And that's just, a couple of months ago, kind of a thing. So I know we're kind of pushing time here. If you might just kind of hit, like you just kind of hit on the sauna, what are a couple of other just kind of highlights in your book that you talk about? You don't have to get into the in-depth that we did just now. And
one of the things that I think people are surprised that I talk about in there is I have a tremendous respect for John Sarno's work for attention myositis, for the idea that our body manifests emotional trauma physically, and that many people that I have seen have had to go through an emotional change as they've gone through a symptom change, especially for major, 15, 20, 30 year chronic ailments. I love John Sarno's work. I think the world needs to know about it. He died a couple of years ago in his 90s as a brilliant, rebellious thinker in chronic pain management. And I speak very highly of him in the book and of his techniques. And I say very often, I've been proven wrong by him. And what I think is purely biomechanical is so in somebody's head sometimes. And it's not in your head like it's fake. The pain is so real.
Right.
But the root of the pain is not physical. And that's something that I believe strongly in. I've seen it on enough occasions in my life, and I've felt stress impact my symptoms enough to know that there is a definitive correlation in me. So I think it's interesting for people, I've got a reputation as being a thinker in the biomechanics community. So to come in there and say it ain't biomechanics all the time is something I'm very proud to be doing in this book. I'm offering what I believe is a truly authentic approach to pain management with no ego involved. Just this is a really good route if you choose to take it.
Yeah. And that's awesome. I think it's one of the things chiropractors can get in trouble with, any profession can get in trouble with, that's the only route that you should take, rather than, hey, let's blend some of these things together. It's like,
who wants all that liability of being the only route? Come on.
Yeah, that's true too. That's true too. Gosh, if you were to kind of summarize just two things, and you've done a couple of those things, just at the end here, just to kind of summarize two things that you would just leave people with at the end of this conversation, what would those two things be the most important right now, where you're at in 2022? So,
number one, for a basic postural tip, pretend the world in front of you smells a little bad. Pull your nose kind of up and away from it, just a little bit. Not up and away from it like this. Up and away from it like you're confused by what it is in front of you.
I like it.
And that occipital glide,
yeah,
that's a movement called occipital glide that's being taught in myriad ways. But what it does is it just aligns the jaw, the neck, the cranium, the brain stem, the vagus nerve, the phrenic nerve. And those are your vital nerves. Those are the ones that make you run well. So before you look at your hips, before you look at your feet, before you look at your belly, chest, your breath pattern, even your neck, look at right where the head and neck meet and lift and breathe in that lifted pattern. And that will alleviate certain things right away. The other one is when you're breathing, remember that your lungs are in your rib cage. This is something I've said a million times. I've literally given a TED talk on this. Your lungs are not in your belly. Oxygen exchange happens in the lung tissue. If your rib cage isn't moving accurately, you are limiting yourself definitively. And breathing is something we do multiple thousands of times every single day. So if you can make like a subtle improvement, you can be very far reaching in your life. So that's where, pay attention to the top of this, right where the skull meets the neck, and pay attention to the uniform movement of the rib cage in breathing. If it ain't moving, you're not breathing well.
Very, very good. So, and then just revisit real quick, where can people follow up with you? I just highly recommend that they do.
If you want to look at my pain relief work, it's called Foundation Training. We have a great app that a lot of people are using and enjoying. It's just the Foundation Training app. You can sign up for it either at the app stores or you can find it at ftstreaming.com.
Okay.
We have 4 books on the subject of foundation training. One of them is for the first year of life, written by my wife, Shaping Your Baby's Foundation. If you're a new parent, it's incredible. And then I have 3 books that I would love if people looked into them. Foundations of Health is the most recent one, and it's an overall perspective on my thoughts on health and well-being. And the first 2 are very specific biomechanics protocols that at the time of them being released were very unique and very new in the world. And I'm very proud of them. So I hope you guys take a time to look at them.
Awesome. Very good. And so I just want to thank you again. I thank you for all the work you're doing. I thank you for taking the time. I did see that TED Talk in December of 2011 and a couple others. And you make yourself available to help people. You're helping so many people. And so I do thank you for your time, Eric. We'll be looking forward. I'm going to be looking forward to following up and learning more and following you and the work that you're doing. So I'll leave everybody with that. Let's try to be strong and confident and open-minded. And I hope everybody has a blessed day. So
thank you, doctor. I appreciate it.
Oh, you're very welcome.